क्या करे 40 साल मैंने बहुत सारी सिगरेट पी, तो मैंने कहा फिर नहीं पीनी थी, इसका कोई तरीका नहीं है कि मैं वो सिगरेट के पैसे दे दूं अभी ताकि वो जो मेरे फेफड़े गल गए वो ठीक हो जाए। अनफॉर्चुनेटली ऐसा कुछ नहीं है। Every cigarette that a person smokes reduces 7 minutes of his life, and this life at least by 7 years is reduced by regular smoking. Believe me, I have tried to make many people give up smoking. And the only way to do it is not gradual reduction. If you go from 40 to 10, believe me, you will go back to 40. It is by just giving up, by realizing. I had a very senior general from the Indian Army who told me that, he was like the Marlborough County man, very smart. And he told me that, oh, listen, I don't believe all this. I just took him to the ward. I showed him a man with his leg cut off, had redo bypass surgery with an abdominal aortic aneurysm which had been grafted and infected. He never smoked thereafter. So there is nothing difficult about smoking. Oscar Wilde said, I've given it many times. I've given it up many times. But Reader's Digest somewhere told me that it takes 42 days to make a habit. So please give it up. Be convinced and give it up once and for all. Knowing is not enough. We must apply. Willing is not enough. We must do. So what about lipids? Somebody had asked what are lipids. Lipids in translation means fat.
What about drinking? You talked only
I'm coming to it. Lipids are fats. It is not that all cholesterol is bad. Without cholesterol we would not have had steroid hormones in our body. Cholesterol is a building block of the cells. But it is the high level and the bad form of cholesterol which need to be controlled, and the causes can be dietary or hereditary. Now we have good and bad cholesterol. The bad cholesterol is referred to as the low density lipoprotein. And we have the good cholesterol, which is the high density lipoprotein. The good cholesterol actually does a reverse cholesterol transport. It takes the cholesterol from the tissues out of the tissues, whereas the bad cholesterol gets inside the artery. Now, it is a concept which we know that people who have elevated cholesterol have a higher incidence of heart disease. And this needs to be controlled. And how does this need to be controlled? Remember, 65% of the cholesterol is made by the body itself, 35% is ingested. But we can control that 35% by eating correctly. Here I've already brought in the effect of things like trans fats, which is refried or deep fried food, which can be very deleterious. Some fats are good. Fats are good fats from, say, fatty fish in cold water areas. They increase the better parts of cholesterol. One of the most difficult admissions, catch anybody in the world, put him before a mirror. The first thing he'll do is, he'll pull in his stomach and pull out his chest. Why? Because nobody wants to believe that he's fat. Now how do you know whether you're fat? Calculate your height in centimeters, subtract 100 from it. If your weight in kilos is more than that, you are overweight. If your body mass index is more than 25, if your waist-hip ratio is more than 1, the list of complications is really long. So why is the battle of the bulge? Because we eat more than what is required, and we've been doing it consistently from the time we have been born. And I'm telling you myself, I have been fighting the battle of the bulge since I've been born. But it is actually an eating disorder. We eat wrong. We tend to eat more than what we expend. When you run, if you get onto a treadmill and you run 1 mile or 2 kilometers, you expend 100 calories. But if you eat less, you can save yourself 500 calories. And when you have saved 7,000 calories, you are likely to lose a kilo. But you need a balanced diet. You need to understand simple rules and rather than complicated rules. So you should make a little balance with your diet, have more green leafy vegetables, have less red meats, have less visible fats, have less dairy fats, have less sugary food, and have, if at all you have to have some meats, you can have chicken, white meat, chicken and fish. And this is what you need to do. And you need to eat superfoods, plenty of superfoods, and eat limited amount of bad foods. I know that it is important. Regardless of the fact that exercise cannot make a person lose weight by the energy balance, what exercise does is, it improves your cardiovascular fitness and it improves the long muscles of the body, which then tend to use up much more calories. And I would recommend, it is written here 30, but 40 minutes, if you're fit, 4 kilometers in 40 minutes, you do it 5 to 6 times a week, it is good. Walking requires nothing but a pair of shoes, and it doesn't matter whether Nike, Reebok or simple Bata. It requires no equipment, it can be done at any time, can be done alone and can be done anywhere. Believe me, just like smoking is addictive, if you exercise, it is also addictive. And a third of every day, we have 8 hours of work, 8 to 10 hours. We have 8 hours of sleep. We still have about 6 to 8 hours left. And that is what we can actually modify, and that we can either take in more stress. We have ladies in our families who, even if they are not stressed, would like to borrow some stress. ये tension करनी है, बहुत जरूरी है tension. So it is better to modify our lives, because the truth of the matter is that you always know the right thing to do. The hard part is doing it. एक दूसरे से न मिल सके, यही विडंबना है जीवन की. Must take a break and must realize, as far as alcohol is concerned, alcohol in moderation. There was a hypothesis that the French, with their diet, used to believe that if you take red wine, it kind of protects you from heart disease. Year 2012 has been a sad year for people who believed in the red wine hypothesis. Because actually there was an Indian cardiologist by the name of Deepak Das who was pushing the resveratrol hypothesis. It was believed that there was a compound called resveratrol in red wine. And this was never stated about other forms of alcohol. As it is, India, wine drinking is very low. If at all people consume alcohol, they consume either rum or whiskey would be the number 1 and number 2 types of alcohol which is consumed, other than country liquor, if you take the whole country. But this year it was found that a lot of Deepak Das's data was fallacious. Unfortunately, he has been vilified, and it is a very sad end to a hypothesis. Some amount of good cholesterol can go up with exercise, with alcohol, but we do not know if this is the right kind of good cholesterol going up. But we certainly know that excess of alcohol is very bad, not just for the heart but also for the liver, especially for the liver. And there is no point in trying to save yourself from heart disease if you are going to get cirrhosis. And even excess amounts of alcohol raises blood pressure, takes your diabetes out of control, and thus it is bad for your heart in those ways. So we need to focus more on prevention than on treatment. No one is too old, and it is never too late to begin. So we can teach an old dog some new tricks, and I hope as a result of this communication, I have tried to explain things to you. And again, one of my favorite quotes is that we all like physicians जो हाँ में हाँ मिलाते हैं. मतलब आप बोले जी ladies come to you, they're rather overweight, they'll tell you, जी डॉक्टर साहब मेरा weight तो ठीक है ना. So they like physicians who say, नहीं मैडम जी बिल्कुल ठीक है, ਤੁਹਾਡਾ weight बिल्कुल ठीक है. Tulsidas probably realized this many years ago, and in Sundarkand he wrote, Sachiv, Vaid, Guru. Sachiv, Vaid, Guru, तीन जो प्रिय बोले भाई हास. If they say, okay, whatever, it can be Sachiv, it can be doctor, it can be guru. If all three say कि जो आपने कहा वो ठीक है, सचिव, वैद, गुरु तीन जो प्रिय बोले भाई हास, राज, धर्म, तन तीन को ओए बेगही नास. So please remember that we may not be nice guys because we tell you don't smoke. We may not be nice guys because we tell you eat less salt. We are not nice guys. My own house, does not like it when I tell them to change the cooking, it's alright. We'll continue to say it because we are only going to give correct advice. Thank you very much, and if there are any questions.
Thank you, Colonel Dhall. You must have a very exact, exciting, enlightening, and entertaining talk on the subject which is so dear and dear to Colonel Dhall. And we will be too pleased to ask any questions if you have. Please feel free. Yes, sir.
What's up? Can you, at a higher age, increase your cardiac output by natural means?
See, cardiac output is a very technical question. Cardiac output is a multiplication factor of stroke volume and heart rate. So cardiac output, by definition, is a product of stroke volume, which the heart ejects in every beat, multiplied by heart rate. Okay. Now, cardiac output, the word cardiac output is used in conditions where people have what is called systolic dysfunction, which means that the pump function is failing. So we need to increase the pump function. Now, the pump function, there were a lot of drugs which were used for increasing pump function, and traditionally we had a derivative, a glycoside derivative of a drug called, of a plant called Lenata purpura, which led to, these were called, because they were glycosides in year 1776. William Withering used it for the first time because this was called foxglove, and he put it to people, and what it did was it kind of kick-started the heart and gave it a little more function. But since 1776 to 2012, none of the drugs which have been used to increase cardiac output on a chronic basis have ever led to increased longevity. The same does not apply in an acute setting. In an acute setting, a person comes in cardiogenic shock, his BP is 50, you can give a lot of drugs to increase his blood pressure and therefore his cardiac output. We use a lot of devices. We put in a balloon pump, which is, we put it in the descending aorta, and this pump actually causes what is called diastolic augmentation. When the heart relaxes, the pump inflates and pushes blood back to the heart, so the coronaries fill more and the heart is put at rest. Now, thereby we increase cardiac output. We also, in an acute setting, we can use other newer therapies which are called like tandem heart, or an impeller device which can improve cardiac output. And many drugs like dopamine, dobutamine, amrinone, milrinone, they can increase in an acute setup. But in a chronic setup, this has never been greatly successful except two things. One is using what are called left ventricular assist devices. These are like artificial hearts which are put in, and they are, now we are miniaturizing them, and maybe a day will come when they can be used like a pacemaker. The second thing which can be done is what we call, in some of these patients who have heart dysfunction, they also have electrical conduction abnormalities, which leads to what is called a left bundle branch block. So imagine there are two sides, two chambers, and because there is a left bundle is electrically blocked, so the right side of the heart contracts first and then the left side of the heart contracts. This is called dyssynchrony. So now we can put in pacemakers which are called cardiac resynchronization therapy, which resynchronize the heart function. Thereby we can increase the cardiac output. But cardiac output today increases with exercise, it increases with everything else. But the focus of medicine has been not really to kick a flog or flog a tired horse. There's no point flogging a tired horse. What we have done is, we can either unload the heart, we can reduce the amount of weight this tired horse is carrying. So we use vasodilators which decrease the load against which the heart functions. So we use drugs like angiotensin converting enzyme inhibitors, people can give Cardase or whatever. And we use We can sometimes do procedures, sometimes we decrease the requirement of the heart by using beta blockers, and sometimes if it is suitable, we do what is called cardiac resynchronization therapy. But beyond that are left ventricular assist devices and replacing the heart called cardiac transplant. But you must realize even in an advanced country like America, only about 2,500 people can undergo cardiac transplants every year. And it's a difficult thing. You know, we have started doing cardiac transplants in India, so I'm sure it will come. But cardiac resynchronization therapy has actually changed the way we look at people who have weak hearts. But they need to be electrically appropriate. They need to have left bundle branch block, wide QRS on ECG. We need to identify them.
Doctor Sahab, what is raw sugar? Raw sugar. Is it good? Jaggery? Raw sugar. RAW, raw sugar. Is it jaggery or good, what we call?
Maybe, sir.
Does it cause damage to the liver?
Sir.
Liver infection?
Sir, it is. Firstly, I do not know what you are referring to by raw sugar.
So one All India Medical Institute doctor was on television saying
See what
that
happens
avoid
is-
raw sugar. So I thought that raw
Because
sugar.
raw sugar may have impurities.
I see.
And when it has impurities, they can also damage your liver.
I see. So that's why it should.
Yes, sir.
Dr. Sahab, if one is having this heart problem, nowadays angiography is done and then followed by angioplasty by putting stents. And there is another testing coronary CT scan, which is better one than.
Okay, let me tell you, CT scan is nothing like, it's just a CAT scan. But because it can be done very fast, when you inject contrast, by acquiring this, the computer can try and give you images which are like a coronary angiogram. But the gold standard remains a catheter coronary angiogram. Because even if you have 64, 128 slice CT scan, a CT scan has some good things and some not so good things. The good things are, it has excellent negative predictive accuracy. My wife is a radiologist, she is here. She took, when I had some difficulty, she made me undergo a CT angio. I had no calcium on CT angio, and my CT angio was normal. So, because it had excellent negative predictive accuracy, I accepted it. But there is a problem. What is the problem? The problem is that when it finds disease, firstly there is a high standard deviation of error, which means that if the radiologist, with due apologies to her and her group of radiologists, when they report it as moderate, it can actually be mild or it can be severe, because there is a high standard deviation of error. And the second thing is, the CT scan cannot look under metal or calcium. So a CT angio is a very good thing to be done in a 35 or a 40-year-old, but it is not a very good thing to be done in a 75 or an 80-year-old. It is not a very good thing to be done after you have had stents put in to see how the stents are behaving. There we do not recommend doing a CT scan for that. It may be a very good thing to study venous grafts and arterial grafts after bypass surgery, but it will not give you a very good idea about the native coronary, because you are likely to have calcium there. So you need to understand the good and not so good of every procedure. But whatever it is, no cardiologist plans an angioplasty only on a CT angio. No surgeon operates or does a bypass surgeon only on a CT angio. We still prefer having a catheter-based angiogram to be able to plan all treatment. I've answered your question.
Are there blood pressure medicines which treat exclusively one of the two high pressures which you mentioned, systolic or diastolic? Now, some patients may have high systolic but a normal diastolic pressure, and if he takes blood pressure medicine, it will but the diastolic pressure, which is already normal, will go below normal, and that could be dangerous. The other thing I want to know, which cooking oil would you recommend? Is corn oil and rice bran oil, are they healthy?
I think your questions are both very good questions, and I congratulate you for this question. See, till when I was a medical undergraduate, we used to feel that it's only the systolic blood pressure which can cause, brain strokes and things like that. Then it was felt that diastolic blood pressure can cause more damage to the heart, whereas systolic has some physics. Because what we are measuring, like I said, I made a statement, I don't know if you gave importance, that high blood pressure is not a disease of the right or the left arm. It is actually something which is in the central circulation which is elevated. And you need to understand that both systolic and diastolic blood pressure contribute to the mean blood pressure. So you can titrate your treatment by a combination of drugs where you can handle sometimes more diastolic. If you have more diastolic hypertension, we tend to give more vasodilators. So these are things which we can adjust. There may not be one group of drugs with like drug A for systolic, drug B for diastolic. It is not like that. But all drugs which act on blood pressure probably act on both because they act on the central aortic